Hi, Peter Helms, Figure Transformations, and today I'd like to discuss what's happening with our adductors. The muscles are getting so tight in the hamstrings, also in the glute, that the adductors are also almost like becoming rendered useless, I guess would be the best way to explain it. The inside of our legs, it's kind of why maybe some of you will start to experience kind of thighs rubbing together as we get older. A lot of us kind of just would contribute that to age, gaining weight. What kind of really more happens is our femurs get kind of twisted and rotated a little bit, and the tissue isn't able to fire the way it once did. And you know, if you think about it, if I shorten the distance from here to here, it kind of starts to render that muscle almost kind of useless, right? So as I've been releasing the tissue in my hamstring on the side, I started to notice that the adductor is starting to kind of firm back up, if you will. A lot of you will notice kind of right by that knee junction, it almost feels like a bony protrusion. There is one a little bit further forward from where I am, but that's where one of our adductors attaches. Another one attaches a little bit below. They kind of both run through that seam almost. Your gracilis, and you get your adductor magnus, brevis. You know, they're all connecting all the way up and down this thigh, and I can kind of trace that line. And I've been using it with the hypervolt. Okay, get in there on that line and start to kind of loosen that tissue. Because what I want to start to do now that I've lengthened the hamstring is start getting that fascia moving again. Because all too often what happens is it becomes really tight, rendering it almost kind of, I use the word useless, but inoperable at certain points in our movement patterns, and that's kind of what happens with a lot of our body. And we're not realizing it. We're looking to the muscles that are overworked and causing us pain, but there's a reason they're being overworked. And a lot of these big ones are getting, again, overlooked, like hamstring getting so tight, you have a hard time kind of hinging over or squatting. Part of that tightness too, though, is also your adductors becoming so tight over the years that they're not as flexible or pliable as they once were. And we kind of use one or two positions to kind of deem our flexibility when we need to kind of be looking at a bigger picture here, and why we can't move a certain way, and then from not being able to move in a certain way, then kind of deducing, okay, well, this muscle's too tight. It's more our tightness, not our weakness, that's rendering us with these feelings. And if we kind of can stretch out the tissues, when we go back to this while I'm talking to you guys, if we can start to facilitate better fascial movement through our muscles, as I have done, my flexibility's increased, kind of my sense of well-being, if you will, in terms of, like, I feel much more comfortable moving. I'm one who's exercised for years, and always kind of try to do different things. I was probably in the best shape of my 20s, but here I am 42 and more flexible now at 42 than I was at 22. And it's not through exercise. I just started implementing or adding a couple videos in there with adding stretching with kind of the TRX, and I'm going to kind of start to implement that more. So, the only workouts I'm going to be doing are the ones that are going to be video recorded, throughout this process. So what we want to start to do is, again, kind of break up this tissue, kind of get it realigned, if you will. Because the odd part about the adductors is they kind of creep in and they kind of swoop in a circle. So, unlike the quadricep and the hamstrings, these ones are going straight down. These guys are coming in at an angle, attaching basically into that kind of bony protrusion underneath the butt or the glute. And that's what I've been starting off with, so I'll kind of start deep up under there. I've seen a couple of videos where I'll do that. Get this side so you guys can see a little bit better. So I'll start up in here, releasing the hamstrings, and also again, where some of the attachments of these adductors go. Now I don't know why I thought the adductors attached kind of somewhere more up in the front. Because if you think of kind of true adduction or coming across the body, there's only one that does that, the gracilis, which is kind of almost up into the groin. But again, another thing we got to take into consideration is if I start to kind of arch my back, well, now my hips aren't in alignment, so now my muscles aren't really doing what I think they're doing as well. Because the minute we take one bone or muscle and shorten or lengthen it or distort the movement pattern, now it distorts all the muscles in that. And that's really what we need to be looking at more when we're trying to kind of fix injuries, fix posture. We need to be looking at the whole body as a unit, and mostly starting from the hips, because the hips control most of our posture in terms of what we can and can't do. Again, you can fix some stuff with the upper body, which I'll make another video momentarily about the traps and the shoulders and how they affect our neck. But again, kind of not in the way that we're thinking. But this is as I've been saying video after video, where we need to start. Okay, we need to start with our adductors, our hamstrings, our hips, our pelvic region. And once we can start to do that, then we're really going to start to see kind of changes throughout the rest of the body. As I've been doing this, I've been noticing great, muscle release, on kind of almost like unprecedented levels. I'm almost amazed every day that I do this, at what I'm finding out, what I'm learning, and how I'm able to facilitate to make this happen faster. That was kind of a big part of this. I tried every exercise, every stretch, martial arts, and this is the first. And as of right now with the technology we have, the only way to kind of do this systematically, releasing the tissue. Same thing on this side, my adductors so big. Part of that's, again, the glute's not firing properly. So again, one muscle's not working right in the body, something else has got to pick it up. It's going to be the opposing muscle, could be the synergist as well. But what you really want to start to do, you want to move better, or you can just kind of get the thighs not rubbing together. You want to start to break up this tissue. First, we got to lengthen those hamstrings. Once we start to lengthen the hamstrings, then we can start to lengthen the adductors. Also a big region I've kind of pointed out. Same thing, the hips. Hips become too tight. Femur can't move properly. And then again, it's just this domino effect that happens as we age. And by kind of going at it backwards, we can kind of start really making a difference in changing how we look, feel, move. I've been looking around and noticed that it's much more of an epidemic than I originally thought. Originally I started just kind of trying to help people with injuries, but I realized kind of posture is the way to go. Because if our posture is better, now we can get rid of those injuries. Alright, I hope you guys enjoyed this video on adductors, what's happening to the body. If you have any information or any questions, feel free to ask. I'm going to make another one on the next one about the traps in the upper body. Alright, thank you.